Sorry for the time lag. There's something wrong and it was just not coming up. Uh, so thanks, colleagues. And it's nice to see so many colleagues from different parts of the world participating in this session as well. I mean, it's amazing to see the participation. And I mean, Tina, Liz, this is something that we were talking about. The interest in this field is, expanding as we move through this pandemic, and how we want to really keep this as a discipline in the countries. So what I will do today is just to share a couple of insights from the work that we are doing. And as the title of the presentation goes, in terms of trying to measure this iceberg. And I'm saying the word trying because it is a trial and error, and it is something that is new. It's something that we are all attempting to do in different ways. And this is what we are looking at and how we are looking at it at the moment. So I saw with interest, your slide where you were talking about the different platforms that are available for you in the countries. And just keep an eye on what you put up there on that screen, because that's something that is going to really be very interesting in this conversation that we will have for the next couple of minutes. So, the reason that we need to, put our focus on the misinformation management area, emerged as the pandemic hit. And we know that the spread of the misinformation around COVID-19 vaccines has really increased since the global introduction of the vaccines in the countries. And we see how some countries, have been able to handle it. Some countries, it has snowballed into a much bigger thing than what it even started off with. Misinformation not only puts this huge immunization drive that the world is working on. I think it's one of the largest immunization drives in the world, in jeopardy, but also it is hitting on and eroding public trust and confidence in routine immunization. I'm bringing routine immunization into the conversation because the impact we are seeing on routine immunization is also severe. I read somewhere that, we've gone back 7 years in terms of routine immunization coverage. And this is huge, because we have been making strides in moving forward on routine immunization, and the impact of this misinformation on the COVID vaccine and the roll-on effect on routine immunization is already being seen in many countries, and this is scary. Increasing number of vaccine adopters or supporters who were our supporters in the past now have become vaccine hesitant. We are also seeing a new breed of anti-vax communities that are emerging. New breed with new talent, with new ways of attacking the system, attacking the information and all that. So it's a big minefield out there. Building trust and demand in the COVID vaccine, as well as other routine immunization services, and counteracting this rapid spread of misinformation about the safety of the vaccines or the efficacy of the vaccines has become even more critical now. This is an essential area to increase overall vaccination coverage and to stop this declining in confidence of vaccines, because what we are so concerned about is the knock-on effect that it will have on routine immunization as well. It's not moving. Oh. Okay. So what I'm going to share with you is a project that UNICEF is working collaboratively with the Public Goods Project, which is a non-profit in the US, and also with the Yale Institute of Public Health. And this is a joint project between UNICEF and these two organizations, and we've started implementing it now for a while, and we just want to share some of that information with you. Basically, the Vaccine Demand Observatory is the main mission of the Vaccine Demand Observatory is to take a look at vaccine, hesitancy, and to see how we can respond to vaccine hesitancy, in terms of real time, in terms of proper information at the right time, in the proper manner. The vision is to have a sustainable global network of social analysts, or unicorns as you all are calling yourself, or infodemic managers, supporting the national immunization programs through social listening and partner coordination, actively informing demand generation, misinformation management, vaccine hesitancy, and of course the new introductions of new vaccines. So in a nutshell, it's a big thing, big piece to chew off, but we're hoping that this would be the ultimate aim of the Vaccine Demand Observatory. So as I said, it's a collaboration between PGP, Yale Institute of Public Health, and UNICEF. And what we've seen in the countries that we are working in, over 100 countries have some form of social listening. So it could be just a very granular method of collecting data and intelligence to a lot more sophisticated multi-channel collection of data. What we are hoping to do is this Vaccine Demand Observatory package. At the initial stages, we are implementing it in 16 countries in its total, in its entirety, but then we are rapidly increasing the footprint in many more countries as we progress. This partnership with Yale also has a component of partnership with Facebook. And we've really seen fantastic success in this partnership because of the access Facebook has to audiences. There are limitations that we are cognizant of, or when it comes to access and literacy, but even within those limitations, we've been able to achieve quite a lot. So, I mean, if you can look at these numbers, you see 102 UNICEF officers that are participating in this project, 4.4 billion impressions of the material and the messaging that we put out there, 657 million unique users, with an average of 6.7 times interaction for each user, 24 million engagements, comments, shares, 14 million website clicks, 6,000 ads that have been managed. But when you look at these numbers, what do you think? Do you think that, is this what we call measuring the iceberg? Does this suffice when it comes to ticking the box for measuring the iceberg? So that's the question that we keep asking ourselves, and that is why we've looked at it in a much more holistic manner, trying to see how do we build the capacity at country level to handle misinformation, to gather misinformation, and then respond to that misinformation. And as byproducts of that work, how does that inform strategy, inform messaging, and material production for countries? So the package, the Vaccine Demand Observatory package that we offer the country officers comes in several components or several pillars. And you see the different pillars here on this slide. So we do work on a preparatory phase with the countries where we're looking at strategy setting, taking a look at understanding what the needs of the country is, what is the situation that they're currently dealing with, defining the solutions together with the country folks. So it's not about a top-down solution, but working on it together at the country level to try and figure out what will work for them. And then together building that strategy for social listening in the country. So each country, what we've noticed is going to be very different and unique depending on their understanding of the situation and the needs of that particular country, and taking into cognizance what they currently have at the country level. Then the first main pillar of the whole initiative looks at listening, basically establishing and or strengthening an existing social listening platform that the country is using. So what we've also seen is several countries have a fairly okay social listening platform already created in the country. And they say, okay, we just want you to help us to strengthen this, and we want you to improve this. We don't want you to mess around too much with it. Or there are some countries saying, we just don't have anything. We just have someone who's scanning the newspapers or the different social media channels on a very cursory note and just picking up things that are mentioned about us. So it's a very basic system that we have. So we want you to come and set up a platform that we can use in our country. So depending on that need and what is available at the country, we then go into the country to support them on either setting it up or strengthening what they have. Then there's a huge component of capacity building that is built into this whole system. So PGP, that is the Public Good Project, together with Yale and UNICEF, we have built a whole set of guidelines, tools, webinars, online training package, which is supplemented with live workshops. And what is very key in this whole partnership is this ongoing technical assistance. So country working on a dashboard that has been launched based on the vaccine demand observatory platforms can pick up the phone and call PGP, who have standby people who will provide technical assistance for any issues that they are dealing with related to the dashboard. So that is very key, because what we've realized is building the capacity at country level will not be enough for them to then take it and run it. For a while, that hand-holding will have to take place. There will be teething problems, there will be new issues that they're dealing with. So we built in this ongoing technical support as a key component of the work that we are providing to the countries. Then, of course, there's an interesting pillar which is looking at gamified behavior change interventions. I'll show you what I'm talking about in a couple of slides later. And then we have another pillar, which is looking at localized digital content and developing this. So a suite of templates to be tailored for country use, a message bank, vaccine acceptance interventions lab, and that is the part that we are working with Yale to implement. So going into a little more details, pillar one, where we talk about establishing creating that social listening platform in the country offices. So you remember in your slide, I saw that you had put a whole load of platforms that are accessible to you. So this is what these inputs are. So you have your above the line media like your radio, TV, newspapers, your broadcast news, your news sites, forums, your social media platforms, whether it's Facebook, YouTube, WhatsApp, TikTok, whatever it is that you have access to. Then we also have things like what you mentioned in terms of CrowdTangle, Signal Labs, Meltwater, Talkwalker, and all that. In the mix to that, you can add your Googles and your Twitter partnerships. And of course, this last bullet, manual investigation, is one of my favorites, because that is where we go back to the old school way of looking at things. Going to the communities, gathering intelligence from the communities, whether it is sitting under a tree, talking near a well, or whatever it is, but you gather that intelligence. And then how do you feed these different types of intelligence that you have gathered on into that platform? And the visualization of the platform will then show you basically what these rumors and misinformation that you have collected. The last part of this slide, which is on the right-hand side of the slide, where it talks about analysis, that is a very key component, because that is where human beings, actually not automated, human beings are looking at the misinformation that has been collected and then grading it in terms of severity. So if it is graded as a red misinformation or a myth or whatever, that means it has to be responded urgently. If it's a yellow, it's something that you have to keep an eye on to see that it doesn't snowball. If it does, then you're expected to respond immediately. And then, of course, the greens are, you can just leave it. That's not something that you need to worry about. This is a little more detail on the visualization, what happens, a little more information on how it is visualized on the dashboard. So we create interactive global, regional, and country level dashboards, which is easily identify and which could be customized metrics filtered by date. So you can go back to see what was said last month or last week. The visualization tools designed to share real-time vaccination conversations in that targeted area or region or geographical area. So just for your information, from October last year to October this year, we've been able to analyze about 284 million mentions. Over 150 recommendations have been made as a result of that analysis. 19.6 million conversations have been monitored with this. So looking at, and putting it under different themes of negative attitudes, research or clinical trials, vaccine ingredients, negative health impacts, disease prevalence. So depending on what you want, we can then categorize it under topics, basically. Some of the key trends in this whole area of work that the Vaccine Demand Observatory offers is, I'm skipping straight to, yes, the additional coverage of these other platforms like the Twitter Firehose, Reddit. We have access to the entire Twitter Firehose, for example. So this is additional buy-in that has, or what should I say, additional component that is added on to this project. But what is very key to us is this human analysis. Automation analysis basically, identifies when the social media accounts are automated, or bots account for. But here we are looking at real people doing this analysis, identifying when the automation is impacting or engaging in social conversations, analyzing connectivity and coordination between the automated accounts. Then it looks at discovering centers of influence within social conversations, audience analysis, emerging narrative detections, and of course, you have access to your historical look back, basically looking at what has been spoken about in the past as well. So this is very, very key in the offer of the Vaccine Demand Observatory. So as I mentioned earlier, this is the traffic light system that we are using. We have direct response, which when it is read, that is absolutely important that we directly address that misinformation. The yellows, it's a passive response. Be prepared to address it if directly asked, and if certain cases consider updating FAQs and whatever information sheets that you're working on and all that. Otherwise, we just continue to focus on that and then see how it pans out. And the green, of course, we just ignore that for the moment because that's not something that needs our attention. This is a look at what the dashboard, the newer dashboard looks like. We're developing it for some of the countries that we're working in. So you have your traffic lights, then you have your topics, and you can basically take a look and see what is existing for your country. This is, for example, a country level dashboard. It comes up with, when this comment was made 3 days ago, 5 days ago, or whatever it is. Is it something that they need to address immediately? And the alerts are organized by country. The second pillar is this whole area of capacity building. So we have a wealth of guides, guides, material, training packages, training material that we have access to. In addition to that, we are just discussing with Yale Institute of Public Health to even look at a fellowship program where countries can send people who are involved in this work for a fellowship program to work with the Yale Institute and then build the capacity and get their hands dirty, and then they go back to the countries to use that knowledge that they have gained. We're looking at institutionalizing this training at country level in pre-service and in-service training, for example. So looking at really deep ways of getting this into the countries, into the way that people think and work, and looking at misinformation as an essential area that we need to focus our attention on. Vaccine misinformation management field guide is one of the things that has been done. Messaging guides have been done. There's a whole host of webinars that have been launched and will be launched in the future as well. There is an online training package which consists of 10 video modules and which is partnered with the vaccine misinformation playbook that goes hand in hand, that is made available Then, of course, the live workshops is a key area or that we focus our attention on, because that has yielded a lot of results for us. And the last pillar is that ongoing technical assistance that I told you about. Countries can pick up the phone, call PGP, and then get whatever support they have. They have, or what we are also looking at is, the whole area of TORs, capacities. Countries that we are working in have asked us, so what will it take for us to set up this system? How many people should we have in our unit? What should be their capacity? Technical capacity, technical knowledge. So we're working with them to build that area of work. So this is just another area of work that we're looking at, but I will not go into detail on that. The Vaccine Misinformation Management Field Guide is a tool that was developed together with partners. As of now, it has been downloaded more than 11,000 times. I've downloaded it 10,990 times, so someone else has downloaded it once, I guess. So, but basically it is available in English, French, Spanish, Arabic, Turkish, and Italian. But there may be more languages that gets added on to this as we move into more countries and all that. Then we also have the vaccine messaging guide that has been developed, and this is also very widely used. These are some of the snapshots of the sessions of webinars that we were doing jointly with Saben. We have the modules that I've spoke about, the playbook and the modules, and the misinformation management guide. This is the area that we were talking about in terms of using entertainment education to inoculate users, basically, to misinformation. So Cranky Uncle is a game that has been produced by a professor in the Monash University. Right now, it has a module that is being used in many schools and on climate change. But what we are now working with the producers of this is to introduce a vaccine module through this game. And this is going to basically give the skills to the users of the game to decide for themselves whether it is misinformation, whether they have been taken for a ride, and how do you give them and build the skills through this game to identify misinformation, basically. So it's very interesting technique. And if you want, you just go to your Play Store and you can download this game, crankyuncle.com, and just play it, the climate change module. And this is what you will see how it will then get translated to a vaccine module. And the last part, of course, is very related to and relevant to our topic of measuring that iceberg. And this is the project that we're working on with Yale, Facebook, and PGP. And it's looking at, an unprecedented level of testing, basically. Looking at putting together behavioral insights, using digital marketing lenses, research frameworks, which includes even an RCT for each of the countries that we are working in. And so currently we are providing it, we started it in 5 countries, and now we are expanding to another 5 countries within the next couple of weeks. And this is in-depth research which looks at rapid A/B testing of creative material, and then able to quickly change and then put the right messages and information out there. What is key in this work with Yale and Facebook is that we're combining market research, tactics and techniques used by the Coca-Colas of this world, or the big private sector organizations in this world, to our social world. So combining these things, so market research based on social listening that includes messaging. Very important aspect is this cultural insights, reference to images and campaigns, colors, how does that work? Then the production team uses this to capture the visuals and what works for that country to that context, and tailoring the creatives to address that. We then move on to, developing. The creative team then brings in their expertise in to create this workshop in country material. This is what then is used to rapid A/B testing for format, for message, and the messenger. So it's not only about what the ad is looking like, but what is the message and who is saying it also was very important in this testing. And we feed in these behavioral insights into this whole thing. So it's a marriage of different areas of work that brings us this fabulous product at the end of the day. Some of the results as we see it from the initial period of the work that we are doing, what we're seeing is modern health systems need tools to listen to, understand, and engage with their communities. Yes, we do have this. This is not rocket science. It's not something new, but this is what we are looking at. Vaccine acceptance is based on different levers, which can be targeted in effective messaging. So the levers that we are looking at and is basically looking at best practices that understands the what is being said, who is saying it, and how is it being said. And the levers that we are using in these campaigns are thoughts and feelings, attitudes, cognitive biases, trust, social norms, beliefs, experiences and fears, and moral values, ideologies, identity, and the worldview. So it's like this Russian doll. So or an onion in that sense. You peel one layer, you go to the next layer, you go to the next layer, and you keep peeling it until you get to the core. There are 10 key principles that we are using in our vaccine messaging, basically. So these are the 10 principles that we work on. We are not assuming that there is vaccine hesitancy. We're not looking at, to anticipate cognitive shortcuts. We tell stories, we build the trust and use credible communicators. And this is very key. This number 4 is very key. Some countries that we are working with have seen, a complete shift in their influencers or their credible sources of informants. Those credible sources that they have worked with for a long time have suddenly become not so credible in the eyes of the public. So, and they're seeing a lot of backlash because of the fact that, we don't trust what this guy is saying anymore. He's done this, or we are not, he's not a expert in this area of work. So this is very key to be figuring out who your credible communicators are going to be. And connecting with the values has really proven to be very effective. Reminding people why we are vaccinating, reinforcing positive social norms. Busting myths can backfire, but we really need to make sure that we step on that very carefully. Communicate vaccination as an aspiration, not as an act, and sell it in a different way. Addressing the audience with vocal vaccine deniers, basically looking at all those areas. Connecting the values is something that I spoke about earlier. Value-based messaging has really worked for us in this work. That is, framing it in the context may have potential to influence vaccine behavior among those who are vaccine hesitant. So care versus harm, fairness versus cheating, loyalty versus betrayal, authoritative versus submissive, purity versus degradation, liberty versus oppression. And we saw in certain countries, for example, in Ukraine, the work that we did, authoritative really worked because that's what they realized, they empathized with, and they were able to take that message in very positively. But in some countries, this value may not have worked. So it really needs that local context understanding when we're looking at developing this type of material. So the collaborative innovation that we are talking about is this partnership which we have with all these organizations to basically develop nuanced understanding of country information ecosystems. And this is really, really very key because you go in blind, you're not going to get anywhere. And that local knowledge, local context can be brought in only by your partners on the ground. So working with them from the beginning to build that system up is absolutely essential. And of course, going into the other areas of pre-testing the messaging among the target audience and evaluating the campaigns to quantify real world impact. Some of what we anticipate as outcomes of this whole project is improved vaccination coverage. I mean, we hope that that's the end goal of what we are all doing. Strengthen the intention to vaccinate as well as improve knowledge, attitudes, and trust. So, how can we move that person from intention to actual action? Local capability and durable partnerships to apply these learnings at scale. And this is absolutely key. How this works is we generate the insights. So data for good analysis, the public Facebook post to generate insights in context to help identify levers for effective messaging. Then we go into designing the targeted content to disseminate via Facebook based on the insights and the local intel and the evidence. Then the messages are tested. Messages are pre-tested for their potential to strengthen vaccine confidence and public demand. And then as the last stage, moving into the last stage, we understand the impact of monitoring vaccination uptake and assessing shifts in knowledge and attitudes. And this is done through the randomized control trial. How the trial work looks like is we have a test and control population of Facebook users in the country. And then the test group gets the Facebook ads. They deliver polls to this group, and then the analysis or the brand lift is then done. So this is the, very granular way of looking at it. What we have done so far is we've worked in 5 countries: Kenya, India, Pakistan, Philippines, and the Ukraine. They've designed 33 campaigns, launched 27 out of them. Ad credits given to run this test from Facebook through UNICEF amounts to about $650,000 worth of ad credits in that first phase. Tens of millions of Facebook users reached with strategic messaging and content. Some of outputs from the test campaigns: 1.4 billion impressions with an average reach of about 7.5 million to 34 million. The variance here is depending on the country and the size of the country. That's why the average is so diverse. Significant recall and positive shifts in attitudes towards the vaccines, and 3.75 million clicks for additional vaccination resources. And this is also very key. So for the mere fact that people are actually clicking and trying to find more information is a very good sign that they really want to improve their knowledge in this area. Some examples of the material that was used in the different countries. And one of the some of the learnings is local engagement being critical to ensure content resonates with the audience. Mix of images and illustrations were very well accepted. Content was tested in multiple languages, and what came out strongly is that local languages are more effective in engaging audiences. When we rely on social listening, local intelligence, and behavior science. So this is key. A significant recall achieved across the various settings. Value-based campaigns shifted attitudes towards vaccine confidence. Many users clicked through for additional resources in response to it. So there is a lot more life in the campaign when more information is being sought. And what we learned, again, there's no amount of emphasis that you can put on this partnership in terms of not only the global partnership, but the partnership at the country level with the country teams, with the Ministry of Health, and working together as a team at that level. Language seems to matter a huge amount, though sometimes some of the countries that we worked in had huge base of users who were comfortable with English, but the moment you had local language content, the engagement was higher. Value-based messaging shifts attitudes, we saw that, and the context is key for moving the needle. This is another slide that I just wanted to share before I leave, is the fact that it doesn't matter where you're getting your data from. And two key things that I would like to leave with you and for you to think about is the need to use multiple sources. Now you see here in this slide, Pakistan used almost 13 sources, and the sources ranged from research, from looking at CRA's community rapid assessments, observational surveys, to the keyhole social media sentiment analysis, helpline, feedback that you get from journalists and repositories. So you have to be able to bring all that together. The other one is the thinking that social listening is not about Facebook listening. It's not about digital listening only. Social listening is about listening to what the people say. So whether you're gathering the information sitting under a tree and talking to the elders, or you are looking at Facebook and trying to gather a trend in narrative, it all falls under social listening. So it's very key that we don't put ourselves at the risk of only looking at that audience that has access to the digital platforms, but we make sure that we have access to what people say and think from the other platforms, people who are marginalized, people who have no access, but who still have a voice. So this is from Pakistan, and this is again from Nepal. Again, you can see how the different sources helped the response at the country level. So whether it's radio, whether it's the hotline, the community volunteers, whether it's TV, or the community interactions that they had, or the social media platforms. And that brought me to the end of my presentation. So